education at Victoria University in Melbourne. It's a university that has a focus on socioeconomic disadvantage, and it has a very strong commitment to its community in the west of Melbourne, which is an area of socioeconomic disadvantage. For that reason, I think there are 4 key elements to any policy framework that wants to improve health in Australia. One is we need to focus on the risk factors for poor health. And the risk factors are not just the usual need to see a doctor when you're not well. It is, what access do you have to housing? What access do you have to education? What access do you have to fresh food? What access do you have to physical activity opportunities? Can you afford them? Are they near you? These are the risk factors we need to address. And if we apply risk factors for poor health in our policy framework, we start to look at a whole of government and a whole of population need for investment in those risk factors that will make the most difference. We've produced recommended policies that cover 10 of those risk factor areas that, if implemented by government now, would get Australia's health into much better shape by the year 2025.
Where do people see that?
It's on our website. It's called Australia's Health Tracker and Getting Australia's Health on Track.
Thank you.
I also say, and this is based on our own work in this area, that if we use the capability framework, which is an economic framework now well developed internationally, to think about how we address those risk factors. Everyone has capability, and when you have poorer access to resources, your capability is reduced. You might be a very healthy infant, but if you don't have access to fresh food, if you don't have access to good education, if you don't have access to physical activity opportunities, if you don't have access to good health care, your capability of being a competent, engaged, contributing adult is significantly reduced. So risk factors and a capability framework is a very simple way forward for a government to say, this is how we're going to go about this. And then there's 2 things that really make a difference to how we think about what needs to be done and what those risk factors are. As a nation, we do not measure our health and well-being at all well. We need regular measurement of population health and illness and chronic disease, and we need to look at the geographical distribution of the inequities in those measures. We need an Australian population health survey as regularly as we need a census, for the very same reason. We need that survey for planning, we need it for monitoring, we need it to know what we're doing works well or that it's not working and we need to change it. And if we don't do that, we're not going to be a healthy nation. And finally, if we think about our community using a concept that's developed internationally by Gil Penaloza, in fact, who was once the urban planner for Colombia. If we think about planning for an 8-year-old and an 80-year-old in all that we do, then our policy framework for urban planning and for transport in particular, but also for the use of community resources, will be much more likely to reach across all levels of both age groups and socioeconomic status. At the moment, we have a policy framework nationally and locally that really only works for 80%. The 10% who can really afford everything it doesn't need to apply to, there's 10% or that figure thereabouts that can't afford things, that can't access things, that has no resources, that are recent migrants, culturally disadvantaged, Aboriginal and Torres Strait Islander, remote and rural Australia. Our policies don't work for them. We have to change the way we think.
Are you getting the sense that this is a process to be able to do that? Are you optimistic from this, or been there, done
I'm
that?
impressed with this policy summit. It is open to very strong commentary, it's open to strong criticism, and it is the most effective way of generating a shared set of goals and a strong commitment to delivering on those goals. Doing things to a community, no matter which part of the community, never works. Doing things with the community, engaging them in planning those things, and delivering those things, and in measuring those things, does.
Thank you very much, Rosemary.
It's a pleasure.